for the next module, which is emergency first aid. Now, gentlemen, this training is important. Why? Because we are going to work in an area which is hazard prone. Means there are chances that you may get injury and all. So we just want to ensure that you can take appropriate immediate action. So let me tell you, gentlemen, this what is the aim of this module? The aim of this module is that the delegates must be able to demonstrate the first aid techniques which we are going to learn. And then these are the learning outcomes, gentlemen. Let me read this for you. To successfully complete this module, delegates must be able to demonstrate immediate first aid actions to include A, B, C. We are also going to learn what is ABC. And then, gentlemen, this is the timetable. The timetable is for 2 hours. That includes your theory, that includes your practical. And then assessment, gentlemen, we are going to assess you by direct observation while you are going to demonstrate and practice the immediate first aid techniques, including ABC. Now, gentlemen, as this is assessment based training, you think that I have done my best, but the instructor has intentionally made me not yet competent. You have the right to appeal against the assessment result. I have already explained, introduced myself, gentlemen. My name is Tejpal Barnela. So I'll be your instructor. Gentlemen, am I going very fast?
No, you're okay.
Yeah, yeah,
Yes,
yeah.
okay.
Yeah. Okay. Thank you, sir. Thank you. So, gentlemen, let's start. Let's start with the module, sir. Let's keep it a very interactive session. So, tell me what is first aid? How do we define first aid?
First aid is the first reaction to cure an injury and to facilitate the patient to at least make it to the hospital or to a doctor.
Correct, sir. Perfectly correct. Any other definition, sir? First aid. First aid means help. The first help you give to someone who has fallen ill or who has injured before the medical help comes. That is called first aid, gentlemen. So let me read the definition for you, gentlemen. First aid is the initial or immediate assistance given to someone who has been injured or taken ill before the arrival of qualified medical assistant. Now, gentlemen, what is the aim of the first aid? The aim of the first aid is to preserve life, to prevent the condition from worsening and promote recovery. Now, gentlemen, what I'll do is I will discuss some of the cases with you, and then I'll come back to this slide, and then I'll tell you more about this. We'll discuss with the examples. So let's see, gentlemen, this is the first aid arrangements. The first aid arrangement will be depending on what type of work your installation or your platform is involved in. Now, there will be a sick bay. Now, gentlemen, the sick bay will be having a bed. This depends on, maybe it will have one bed or two beds or more beds. This entirely depends on the job activity which your vessel or platform is engaged in. We will be having AED. AED is like automated external defibrillator, and we are also going to have oxygen resuscitator. Especially, gentlemen, if your vessel or your platform is involved in chemicals, and the people who are going to handle chemicals, will have the emergency showers. We'll also have the eye wash stations. We'll be having the stretchers, gentlemen. These stretchers will be prominently located in different locations depending on the risk assessment. We'll also have the first aid boxes at workplace and in the lifeboat. We have just gone through the lifeboat, the sea survival, and in that you must have discussed about the first aid. Have we discussed this, gentlemen? So your lifeboat and your life raft will also be having the first aid kits. Have we discussed about this? The first aid kit in the lifeboat and in the life rafts?
No.
No. Was this the secondary actions discussed? What are the secondary actions to be taken? Yeah.
No.
No. So
No. No.
don't worry. So I'll discuss this again. Yeah. Now, so what we have is, for example, this is your platform. This is your platform. In case of an emergency, your emergency coordination center or your medic will be having a hotline. He can contact the standby vessel, and he can also contact the helicopters. He can also contact other foreign going ships, and he can also contact the base in case of an emergency. Just the first aid, gentlemen, and the medical evacuation. So this is the arrangement which we have at offshore. Now, gentlemen, let's discuss about the immediate actions to be taken before the medic or the first aider comes. The first scenario which we have to do is we have to assess the situation. Now, while assessing the situation, gentlemen, please ensure that you do not put yourself in danger. Please make the area safe. And then, gentlemen, in case of an emergency, what can happen is maybe there are more than one casualty, especially in case of an emergency. So, what we have to do is please attend any unconscious casualty first. If we don't attend the unconscious casualty, maybe he will die. The second thing, the person who is not breathing, please give the first priority, and then second priority goes to the person who is bleeding, and the third priority goes to the person who is who has a problem with the broken bones or burns, and then give the priority to other person. Send for the help as soon as possible. Now, gentlemen, everything, all these things can be described in the form of Dr. ABC. This is what we exactly have to do. So the first thing is, gentlemen, you have to raise an alarm. For example, you have to shout, help, help, help. For example, somebody hears help, help, help. He doesn't know what type of help you require. So that is why it is always important. Please say medical emergency. Now, gentlemen, some people, once they hear the word emergency, they get panic. So what we have to do is we also have to tell them that someone come with the first aid box. Yeah. So this is what we can do. Yeah. Any questions about this, gentlemen?
No.
Yeah. So this is the requirement. So please call for the help, and someone, please tell them someone come with the first aid box. Please specify the location. Maybe he is with the first aid box, he doesn't know where is the location. So, and the each and every second is important. That is why please specify the location. Now, gentlemen, please remember the acronym Dr. ABC. D stands for danger. Now, danger for the casualty and for yourself. Please make the area safe. I'll give you some example, gentlemen. For example, there is an oil spill, and somebody has slipped. And if you want to approach, can I run and approach him? What do you think? Can I approach him, gentlemen? If there is an oil spill and somebody has slipped, can I approach him? What do you say? Sir, hope you are able to understand me, sir. Hope you are able to hear my voice, sir. Am I loud and clear?
Yes, you are.
Yeah. So, for example, there is an oil spill. There is an oil spill on the deck, and somebody has fallen or somebody has slipped, and he is injured, and he is calling for the help. Can I approach him?
Yes, you can.
Yes, I
A
can, but
slow.
yeah, very good, sir. Slow. This is what we expect from you. Yeah, you have to, you can approach him, but with the precaution. For example, gentlemen, there is a friend of mine. He's an electrician. He was working with the switchboards. Yeah, and then he got electrocuted. My question is, can I approach him? What do you think?
Have to switch off the main power
Very good,
first.
sir. Very good. Who has answered this?
Get the
Very good, sir. Very good. After switching off, that means I will make the area safe and then I will approach him. Yeah, I'll give you one more example, gentlemen. There's a person lying down, and with him, he was having a H2S detector, and the H2S detector is beeping, beep, 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 beep. What should I do? Should I approach him? Can I approach him?
negative. No, you
No,
have
no,
to
no.
on yourself.
Maybe if I am trained, if I have the appropriate respiratory equipment, I can approach him. I'll give you another scenario, gentlemen. Your friend, one of your friend, he was going upstairs, he slipped, and then he fall down. Can I approach him, gentlemen? Hope, should I repeat the scenario? There's a small staircase. Your friend was going up and he slipped and he has fallen down. He got injured. He wants the help from you. Can I approach him? And you have seen that there is no drop objects,
Yes.
there is no drop objects also. Can I approach him, gentlemen? Should I repeat the scenario? Should I repeat the scenario, gentlemen?
Yes, you can approach the slippery surface.
Yes, yes, I can approach. Yes, I can approach. That means you have to approach him, see for the danger. In case there is a danger, please, please check the danger for you and for the casualty. Please make the area safe. And then, gentlemen, this R. Let's go to R. R stands for response. Now, gentlemen, you can get the response in four way. The option number one is alert. Maybe he's alert when you're speaking to him. Hello, what happened to you, sir? I fall down. I'm not able to get up. I have some pain. I think I have some pain in my hand or in my leg. That means he's alert. He's speaking with you. He's trying. He is able to move his hands. Yeah, that is called alert. Now, gentlemen, maybe he is not able to speak with you. Maybe he is not able to move his body parts. But when you go near him and you say, hello, what happened to you? You tap his shoulders and you say, open your eyes. And slowly he opens his eyes. That means he is responding to your voice. So that type of person is responsive to your voice. Am I clear on this, gentlemen?
Yeah.
Yeah. Now example for gentlemen, when you ask him to open your eyes, but he's not opening his eyes, when you give it tabs on his shoulder and give him pinch on his earlobes, you know, the face expression changes. That means he is responding to the pain. Am I clear on this, gentlemen?
Yeah.
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 Now, for example, after giving the pinch, then also he is not showing the response. Then we come to a conclusion that he is What do you think?
Unconscious.
Not unconscious, gentlemen. We are not medic. Yeah, we are not medical professional. We will say he is not responsive. That means he is not responding to us. The only unconscious, this word can be used by the medic or the medical professional. Am I clear on this, gentlemen?
Yes.
Yeah. Now, gentlemen, what we have to think is, in case somebody is unresponsive, the first thing that should come to our mind is that he has become unresponsive, and whenever a body becomes unresponsive, the muscles relax. The tongue is also a muscle, so it may have flipped back and it may have blocked the airway. So, gentlemen, A stands for airway. A stands for airway. What we need to do is we have to clear the airway, and how we can clear the airway is through head tilt and chin lift method. What you can do is you can place one of the hand on his forehead, supported by two finger, and then head tilt chin lift. When we do this, gentlemen, what will happen is the tongue will come in front. Why it will come in front is because the tongue is attached to the lower jaw. Once it comes, gentlemen, what happens is the airway is open. Now, gentlemen, once the airway is open, that means he should breathe. So B stands for breathing. Now, gentlemen, B stands for breathing. So what we can do is you have to look, listen, and feel. So what you can do is you have to bring your ear next to his nose and look. If he is breathing, gentlemen, the chest will fall and rise. If he is breathing, gentlemen, you can listen the breathing voice. If he is breathing, gentlemen, you can feel the warm air on your cheek. Do this for 10 seconds. Am I clear on this, gentlemen, or should I explain it one more time?
No, it's clear.
Yeah. Now, gentlemen, and then C stands for, we'll discuss about this in a while. Now, gentlemen, if you have done this course before, what they used to tell is, they used to tell you that in case there is an obstruction, clear the obstruction from the airway or from his mouth. Do you still remember this, gentlemen? Before clearing the airway, they used to tell, please clear the obstruction. Maybe there's a blood or sputum. Maybe there's some chewing gum, tobacco. They used to tell you to clear it. Any one of you can remember this, gentlemen?
Yeah.
Yeah, but nowadays, gentlemen, we don't recommend this. Why? Because what has happened is some of us we have tried to some of us has tried to remove the obstruction, and while doing this, actually they have pushed the obstruction even deeper. So that is why we don't recommend it, gentlemen. Now, what we say is directly open his airway, even if his mouth is closed. For example, if jaw is locked, even if you try to do this head tilt and chin lift method, the airway will be open through the nose. Am I clear on this, gentlemen, or should I repeat this?
Clear.
Yeah. Now, gentlemen, there are two possibilities. One possibility, so we have discussed about the look, listen, feel, and there is two possibility. The possibility number one is he is breathing. That's good sign for us. So, we go for secondary survey. In secondary survey, what we do is we put on the gloves. And where are we going to get the gloves from, gentlemen? Where can I get the gloves from? To carry out the survey to check somebody, where can I get the gloves from? Can I use leather gloves, gentlemen?
You have in the gloves in the first aid box.
Perfect, sir, perfect. And how the first aid box will come to me? Will it come
Whichever in
automatically?
emergency,
Very good,
you will
sir. We
call
have
out
to,
for it.
yeah, very good. We have to call. So that is why it is very, very important that we shout for help before we actually approach. In case nothing has happened to the casualty, then also no problem at all, gentlemen. We follow no name, no blame, no shame policy. That means in case you have nothing is wrong, no problem at all. Everybody will appreciate that you have tried to take some response. And then, gentlemen, check for the bleeding. Do the survey from head to toe level, and then burns bones. And in case, gentlemen, he is not suffering from any spinal cord injury, what you can do is you can give him a recovery position. What is recovery position, gentlemen? We'll discuss in a while. The option number two is he is not breathing. Now, gentlemen, if he's not breathing, that means we can come to a conclusion that eventually, if he's not breathing, his heart will also stop. Now, if the heart stops, gentlemen, heart is like a pump. That means the blood is not circulating. All of you had your dinner, I mean to say, had your lunch, gentlemen.
Yes.
Yeah. Now, gentlemen, for normal function of our body, we require energy. Do we agree, gentlemen? Do we require energy for normal function of our body?
Yes.
Yes, we do. So what happens is when how we are going to get this energy is through food we eat. So whenever we eat something, it goes inside, it gets digested, and after digestion, it gets converted into glucose. And these glucose are transported to different parts of our body through our blood vessels. Now, gentlemen, it is like a truck, and the truck, the fuel tank is full. But my question is, will the truck starts moving of its own, or do we require to ignite the fuel before it starts moving?
Ignite.
Ignite. Now, gentlemen, ignite means we have to burn it. In the same way, if you want to metabolize the glucose, in layman terms, if you want to burn the glucose to release the energy, we have to burn the glucose. And for burning something, gentlemen, we require oxygen. And how do we get this oxygen? Is through the airway. We inhale, so it goes to our lungs. In the lungs, gentlemen, we have red blood cell. The red blood cell will combine with the oxygen, and then it goes to your heart. When it goes to your heart, gentlemen, heart is like a pump, and we have blood vessels called arteries. These arteries will carry oxygen rich blood from our heart to different parts of our body. It breaks the glucose. A lot of amount of energy is released, and this energy is used to for the normal function of our body parts. During this process, gentlemen, carbon dioxide is also formed. So we have another blood vessels, we call them as veins. These veins will carry oxygen deficient blood from different parts of our body back to our heart, and then it goes to our lungs. The carbon dioxide level will increase, and this will stimulate our brain will give a signal to our respiratory system, come on, our carbon dioxide level is going up, exhale. We exhale. It also says oxygen level has also gone down, come on, inhale. We inhale, and these continues. So the main purpose is our brain. The brain is one who controls all the function of our body, and the brain also requires energy, and that energy is in the form of glucose, and to break that we also require, the brain also requires oxygen. Now gentlemen, the question is, how long, if we do not, if the brain doesn't get oxygen for say 3 to 4 minutes, it can cause irreversible damage to the brain cells and we will not be able to retrieve. So that is why it is very very important, gentlemen, we have to ensure that the brain is getting the oxygen. Now who was giving the oxygen is our heart, but our heart has stopped. So what we have to give, what we have to do is we have to give the compression. Now for giving the compression, gentlemen, that means the c starts the c stands for circulation. Now so what is circulation is like CPR, we have to give him CPR. now cpr now cpr Now, CPR is cardiopulmonary resuscitation, which is a combination of 30 compressions and 2 rescue breaths. The big question is where we have to give this compression, and we have to give the compression on the heart. The big question is, gentlemen, where is the heart? Who is going to tell me where is the heart? Where is the location of the heart, gentlemen? Who will tell me?
Left hand side.
Left hand side.
Other.
Any other questions, sir?
It's almost center of chest on the upper side.
Now, gentlemen, if somebody is going to ask me, no. Okay, okay. Go ahead. Yeah, correct. In somebody is going to ask me, where is your heart? I will say, sir, my heart is in Haryana. But actually, it is in the center. It is in the center, slightly turned to, tilted towards your left. So what we can do is, gentlemen, we can make an imaginary line. There's something called, there's called sternum. The breastbone, like sternum, 3 fingers above this. So a person like me, no, sir, I will not understand. मुझे नहीं समझ में आ रहा, इतना देसी पढ़ा. So what you can do is, gentlemen, you can make an imaginary line, and then you can take the reference from your nipples. The intersection point is the location of your heart. Now, gentlemen, some people, they have big body. Maybe you will not be able to take the reference from the nipples. So what you can do is you can take the reference from the armpit. So this is the location, gentlemen. Now, what you can do is what you can do is you can place the heel of the palm and lock it with other hand. Why should I lock it with the other hand? Is to ensure that your hand doesn't move. Now, gentlemen, what we have to do is, your elbow should be straight, come directly over the body, over the casualty's body, and give 30 compressions. How should be the compression? It should be fast and quick, fast and hard. Fast means the rate should be 100 to 120 times per minute with the rhythm of the heart. And by hard I means the depth should be say 5 centimeters. If we are not compressing 5 centimeters, the purpose gets defeated. If the depth is more, we are likely to break its ribs. Now, gentlemen, after this 30 compressions, what we have to do is we have to give them 2 rescue breaths. Now, gentlemen, we always have to use precautions. So have you seen this, gentlemen? We call this as pocket mask. From where I can get this pocket mask? Who is going to tell me? From where I can get this pocket mask? Come on. Who is going to tell me from where I can get this pocket mask?
From first aid kit.
Perfect, sir. Perfect. From the first aid kit. That is why it is very important that I have to call. I have to call for the help. Yeah. So, gentlemen, until the rescue, until the first aider, or until somebody is coming for your help, what we can do is, you can continue giving him compression, and then give him 2 rescue breaths. Yeah. And this should continue. So, gentlemen, what I'll do is, this is the right method, gentlemen. I'll give you the quality counts. So what you have to do is, please ensure that the one thing is the elbow should be straight. Yeah. Second thing is, give the compression fast. Fast means 100 to 120 times per minute with the rhythm of the heart, gentlemen. And then compression should be say 5 centimeter. Please do not lean over the casualty. Can I show you a video, gentlemen? You'll get more idea. Can I show you a video? Come on.
Yeah.
Yeah. Can you hear the sound, gentlemen? Can you hear the video sound?
Yeah.
Okay.
Hello, in this health sketch, we want to talk to you about CPR, which stands for cardiopulmonary resuscitation. We use CPR when someone has collapsed and is not breathing because it can keep people alive until emergency services arrive. Learning these simple life saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?" If there is no response, you need to. S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the center of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimeters. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step. D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy to use defibrillator on site called an automatic external defibrillator or AED. Automatic means that it is the machine that decides what to do, so you can't go wrong, and it even talks you through the steps. If there is no AED available, keep going with CPR until the ambulance arrives. That's it. So to recap, remember doctor's ABC, and if you have it, D. That's D for danger, R for response, S, shout for help, A for airway, B for breathing, C for circulation, and D for defibrillation. In this health sketch, we've shown you the simple steps you can take to help someone who has collapsed, is not breathing, or not breathing normally. Why not take a training course to practice these steps? Share this video with friends.
All right, gentlemen. So, how was the video? Was it useful?
Yes.
Yeah, yeah. If you want, gentlemen, I can share that video with you also. Okay. So, can I move forward, gentlemen? Am I going very fast?
No, no, it's okay.
Sure. Everybody, only one person. Come on. I want 6 boys. Come on, gentlemen. Can you hear me?
Yes, sir.
Yes. Sure. All right then. So, gentlemen, the big question is until when I should continue CPR. I should continue CPR until the medic comes. The medic arrives and he takes over. This is option number one. Option number two is the victim starts breathing off his own normally. So that is why, gentlemen, whenever you are giving compression, please Please keep your eyes on the casualty's face. Maybe the face expression changes. That means he is responding to pain. That means he is responsive. If he is responsive, gentlemen, we don't have to give him CPR. Or maybe you become exhausted, gentlemen. This is exhaustive. So please don't think that I'm giving CPR, I'm getting exhausted. No, 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 it is exhaustive. And the fourth scenario is the scene becomes unsafe. Now, gentlemen, let's assume that he has come back to the conscious level. For example, if the casualty shows sign of becoming responsive, such as coughing, opening eyes, speaking, and starting to breathe normally, put them in the recovery position and monitor their level of response and preparing to give the CPR again if necessary. So this is called CPR position, gentlemen. When you come for the practical assessment, we'll demonstrate you the CPR, this position. What is the main purpose of this position is, in case if I leave the casualty in the normal lying situation, maybe the tongue can fall back. Number one, maybe if he vomits, the vomit may obstruct the airway. So if he is in this position, gentlemen, this will ensure that the airway is also open, always open. Number one. Second thing is, in case he vomits, the vomit will come out. Am I clear on this, gentlemen? We'll give you better explanation, better demonstration once you come for the practical assessment. Can I move forward, gentlemen?
Okay.
Yeah. Now, gentlemen, what we have is, let's talk about the bleeding and what are the immediate actions we can take. Now, there are different three types of bleeding. One is arterial bleeding, venous bleeding, and capillaries bleeding. How can we recognize them? How can we identify them? For the arteries, gentlemen, arteries are the blood vessels which carry oxygen-rich blood from your heart to different parts of your body, gentlemen. So you can see the blood is sprouting out with the pulse, with the rhythm of the heart. That means pulsating flow. And if you see the color, gentlemen, it will be bright red color. Why it is bright red color is because it is rich in oxygen. And now, gentlemen, we have another blood vessels. We call them as veins. The veins are the blood vessels which carry carbon dioxide deficient blood from different parts of our body to our heart. That means the oxygen is less. So, gentlemen, the color is dark red color. It is approaching from different parts of our body to the heart. That means there is no pressure also. Steady and slow flow. Now, gentlemen, if whenever we go for the medical, you must have you must have noticed the color. What is the color? For example, you give blood, the blood for the sample for some test. What is the color? Have you noticed the color? Is it bright red or dark red? Who is going to answer me this
Dark red.
question? Dark red. Why? Because they can take it from the veins. And now, gentlemen, we have another blood vessels. These are the minute blood vessels. We call them as capillaries. This is where the arteries and veins meet each other. This is where the oxygen carbon dioxide gas exchange take place. Now, gentlemen, if what we should do if the bleeding isn't controlled quickly, the answer is they may lose lot of blood and become unresponsive or develop shock. Now, if someone's bleeding from mouth or nose, what we have to do is they may find it hard to breathe and may become unresponsive. So, if there is there any, what do you think, gentlemen? Is there any hazard if I touch the wound with my bare hand? I don't have the gloves. Can I touch him without the gloves, gentlemen? What is the possibility? Is there any chances of
That can create
infection? Yeah,
infection.
correct. Perfect. With all the open wounds, there's a risk of infection. So wash your hands and use gloves if you have any, to prevent any infection passing between between both of you. Now, gentlemen, one of the control measures we normally do is we everyone who is going offshore, they have to go through the medical screening. So please ensure that the people who are working at offshore, they are not suffering from any diseases like which can be communicated from one person to another. Now, gentlemen, let's see what is the immediate effect. The immediate effect is, please put on the gloves, remove the clothing around the wound, if any. And there are two possibilities. Possibility number one is maybe there's an object inside. In case there's an object inside, gentlemen, please do not try to pull out anything from the wound. Actually, it is stemming your wound. Apply direct pressure on either side of the object and not directly on this. If there is nothing, gentlemen, what you can do is you can take a sterile gauze and apply direct pressure and elevate this above the level of the heart. What we can do is, gentlemen, always remember C. S stands for help the casualty to sit or lie down, lie the person down, and then examine the wound, elevate above your heart level, and apply direct pressure. So, gentlemen, two things always remember: direct pressure and elevate. Am I clear on this, gentlemen? If I am clear, let me move forward.
Yes.
Yeah. Now, gentlemen, let's talk about burns. What is the, let's talk about burns. Now, burns it happens when you come in contact with any source of heat, radiation, electricity, chemical, freezing surface that will cause burns or scalds. For example, like dry burns, if you have come in contact with hot surface or fire or friction. Now, scalds are the burns caused by hot liquids or hot fat or oil or the steam. And now, generally, we also have the chemicals. Normally we deal with chemicals. That includes drilling chemicals, process chemicals, or domestic cleaning products or paint solvents. These are corrosive in nature. So the chemicals which are corrosive in nature, they have a capability to cause chemical burns. Now we also have the electrical burn. We may also get electrical burns, especially if you are carrying out the maintenance on the electrical applications, if you are dealing with the faulty equipments, or if you are dealing with the high voltage cables. We also have cold burn, gentlemen, especially while you are working with the freezing temperatures or the frozen foreign objects, or like you're repairing the refrigerants and there's a leakage of refrigerant gases. And then we also have the radiation, the sunburns, ultraviolet rays, and if you're overexposed to the x-rays. Yeah. So there are different types of burns, gentlemen. Let's discuss what is what is the layer of the skin. Now if you see, the topmost skin layer is called epidermis. Now, just underneath this, gentlemen, we call this as dermis. This is the layer of tissues just beneath, which contains blood capillaries, nerve endings, sweat glands, and the hair follicles. Now, gentlemen, and the lowermost is called
Tenga
subcutaneous.
pellicle.
Can you hear me, sir? Any questions, sir? Can I move forward?
Yes, please go ahead. Please
Yeah,
go ahead.
subcutaneous, or this is the deeper layer of fat and tissues. Now, gentlemen, let's see. There are different degrees of burns. For example, the first is called superficial burn, or we also call this as a first degree burn. So, what happens here is the outer layer or the epidermis layer is damaged. So, you can see this in the picture. The color will be red. There will be swelling. There will be tenderness and discomfort, and this is normally very painful. Why this is painful is because these are the nerves ending to this layer, and these nerves are connected to the brain, and the brain tells this is painful. Now, the second thing is, gentlemen, the partial thickness burn, or the second degree burn. This is where the epidermis and the dermis are damaged. This is what we can see in the picture, gentlemen. The red and blotchy, the swollen, and the blisters. Now, gentlemen, whenever a foreign object comes to our body, our body tries to respond. Now, what is the foreign object is the heat. So our body tries to cool it down. It may cool it down in the form of blisters. So in the second degree burn, gentlemen, you will get blisters, and this may be very painful or painless depending on whether these nerves connected to the brain are present in that particular area or not. Maybe you'll get the pain around the burn, but not on the burn, gentlemen. Now, the third degree is epidermis, dermis, and subcutaneous are damaged. Tissues underneath appear pale and blackened. The skin will be dry and white, brown and or black with no blisters. Please, I repeat it again, gentlemen, there are no blisters, and the texture of the skin may also be leathery or waxy, red and splotchy. Now, gentlemen, in this case also, it is painless. Why? Because the nerves which are ending to the brain, these are completely damaged. Maybe the burn will be around maybe the pain will be around the burn, but not at the point of the burn. Now, Jalen, one more thing which we have to notice is you will get blisters only in the second degree burn, not in the first degree burn, and not in the third degree burn. Am I clear on this, gentlemen? If we are clear, let's move to the immediate action or the first aid action for the burns. Am I clear on this, gentlemen?
Yes.
Yeah, can I move forward? Yeah.
Yes.
So what happens is, let's see what are the immediate actions. The immediate action is cool the burn under running water for 10 minutes in the normal water. For example, if you're working in the Middle East, maybe the water coming from the tap water may be warm. So please ensure this. It should not be very cold also, gentlemen. Why? Because it can actually give more. It can have the adverse effect on the burn. Yeah. And then, gentlemen, remove or cut the burns cloth if it is not sticking to the skin. This is what we can do. Now, normally the jewelries are not allowed at offshore, but in case if you're wearing some watches and all, please remove them. What we can do is cover the burnt area with non-soft sterile dressing, such as clenched film. Have you seen this clenched film, gentlemen? Normally we use this film for covering the food stuff. Have you seen this, gentlemen? Have you seen this, gentlemen? Are you there?
Yes.
Yeah. So what we can do is, you must have seen this clinch film. Normally we use this clinch film to cover the burnt area. This will prevent the infection. So there are two things. One is cool and cover. This is what you can do. What we don't have to do is apply any cream or ointment and touch the burnt area, or don't apply ice. What we should not do is burst the blisters. If you do so, it will actually result in infection. And then please do not apply the adhesive dressing also. Am I clear on this, gentlemen? Can I move forward?
Yes, you
Yeah.
are.
Now, gentlemen,
Okay.
let's talk about the
Yes.
chemicals. Let's talk about the chemical burns, gentlemen. Now, the normal procedure while working offshore is, now whenever our workers are working or handling with chemicals, the basic treatment for we train them as per the MSDS, Material Safety Data Sheets. Nowadays, we call them as SDS, Safety Data Sheets. Exactly the same thing. If you see here, the first aid measures will be written. What will happen in case it comes in contact with your eyes, with your skin, if you inhale it or if you inject it. So the basic treatment for the chemical burns is cold running water. First aid should observe the COSH means control of substance hazardous to health assessment of their workplace, and be aware of any specific treatment. Identify the emergency shower or eye wash stations before starting the work. Now, gentlemen, please ensure that the area is safe and chemical is removed. Ventilate the area and seal the chemical containers so that, gentlemen, the fumes will not come out of the container. And then refer to MSDS. This is what we have just discussed, and you will get the proper training about this also. We normally conduct the emergency response drills also, so that you are aware about this and you also know what is the appropriate procedures to be followed in case of an emergency. Remove the contaminated clothes and treat as normal burns. Call for the medical attention, gentlemen. If casualty becomes unresponsive, carry out the procedure for basic life support, but be aware that the chemical may have been inhaled. So please, this is what we have to do, gentlemen. And have someone of you has worked on pipe laying barges, or the area where we do coating of the pipelines. Have you worked on these type of sites, gentlemen? If you have worked, gentlemen, you must have noticed that chemical is very, very corrosive. It is very dangerous. So that is why, gentlemen, what the normal procedure is, the medic will always be present on the site whenever they are dealing with the chemical. So this is also one of the control measures. So what we need to do, gentlemen, treat this as the normal one. Am I clear on this, gentlemen?
Yeah.
Yeah, and refer to the MSDs. Now, gentlemen, our let's talk about the temperature. For example, our body, for example, let me give an example of home. Now, in case of summer season, what we do is we require the cool air. This is where we use our fan or AC. In the winter season, when what we do is we require our heater. Now, the main purpose of these two are controlling the temperature of the house. In the same way, gentlemen, if we compare, let's correlate this here. So your home is like your body, And now, gentlemen, in case you are feeling hot, what happens is we have something called, our brain has something called thermostats that regulate the temperature inside your home. The hypothalamus regulates our body temperature, responding to the internal and external stimuli, and make adjustment to keep the body within 1 or 2 degree of 37 degrees Celsius. So, in case the weather is hot, gentlemen, or warm, the hypothalamus will give a signal to your sweating glands, and they do sweating. Now, gentlemen, if it is cold, the hypothalamus will give a signal to your muscles to contract, and this is why you start shivering. Got an idea, gentlemen, about this?
Yes.
Yeah.
Yeah.
Now let's try to understand two medical conditions. One is heat exhaustion. The second is heat stroke. Let's discuss about the heat exhaustion first. So in the summer season or the hot weather, what can happen is, there's excessive loss of body fluids. This condition is called heat exhaustion. What can happen is maybe faint or dizziness. Excessive sweating will be there. When there is excessive sweating, the cool, pale, clammy skin will be there. Nausea or vomiting, rapid weak pulse, and there are chances of muscle cramps. So what we need to do is, what has happened is excessive loss of body fluids. Please replace the body fluids. So what you can do is, you can give him some water to drink. In the normal at home, gentlemen, what we do is, we have you heard about ORS, oral rehydration solution? Have you heard about this, sir?
Yes.
Yeah. So it
Yes.
contains some salts. Now, my question is, for example, the ORS is available in your first aid box. Can I provide this ORS to the casualty before the medic comes? Should I repeat my question, gentlemen? What do you think? Can I provide ORS solution to the casualty before the medic comes? Yes or no?
I think yes, if he's conscious. Yes.
Uh-huh. Okay. Yes, yes, I do agree. He is conscious. Can I provide him, sir?
Yes, you
Yeah.
can. Yes.
Now, what has happened is, we have to learn from our history. What has happened is, sometimes, this ORS contains salts like sodium. Yeah.
Right.
Like sodium and like potassium, and some people, they are allergic to these salts. So it is always better, gentlemen, even if it is ORS is available, let the medic come, let the medic takes the call. Why? Because he will be knowing about his medical history. Am I clear on this, gentlemen?
Yes.
Yeah.
Yes.
So please,
How will
please.
the medic know about the
So why?
medical
Because
history?
when you go there, he will be asking you to sign a medical declaration form, something like this, with your history, or whenever you go to your company doctor. So what he will be doing is, he will be asking to declare whether you have allergy to something, or like, have
But
you have you got some
in in in
so.
situations like heat exhaustion and heat stroke,
Mhm.
where will be the time to go to the hospital,
Not
Sandeep?
hospital, sir. Not hospital. Yeah, I am talking about the offshore environment only. So your medic, he will be very very near to you. So better thing is, you take him to a shaded position and give him water until the doctor comes. He knows about his history, whether he will take a call whether he should provide him ORS or not, because he must have seen, he must have declared that maybe I'm allergic to sodium salt, so he will not be providing him, sir. If he is not returned, sir, he is not declared, he will be providing it, sir. Am I clear on this, sir?
Yeah.
Yeah. So, this is what we have learned. I'll not tell you the country's name, but this happened somewhere in the Middle East. Somebody has provided the ORS. ORS is as good as, our normal saline water, like with salt. But
Yeah.
the situation got agitated. And why I'm specifying all this thing is because, gentlemen, at the offshore, we don't have the full facilities like hospitals and all. So, let all these decisions come from the medic. Am I clear on this, sir?
Okay, because
Yeah.
normally there is a practice in working in under heat conditions.
Mm-hmm.
The ORS and sometimes some
Correct,
other
correct, correct, correct.
supplementary drinks are provided,
Mm-hmm.
and people are advised to take it on regular basis.
Correct. And then he will also ensure that all these things are kept confidential. So maybe in case somebody has allergic for the sodium salts and all, so he will say please don't take it. For it's better to take plain water. Yeah. So all these things we keep it very confidential. We don't declare it with everyone. So can I move forward?
Yeah.
Yeah. So
Yes.
the second thing scenario is heat stroke. Now the heat stroke, we have something called hypothalamus, which we have just discussed. Yeah, hypothalamus is like your thermostat, which is in the brain. Now this has failed. So when this has failed, it cannot regulate your body temperature. It cannot give the signal to your sweating glands. When it cannot give the signal to your sweating glands, the temperature will rise. This is called heat stroke. Now some of the symptoms is like headache, dizziness, discomfort, restlessness, or confusion. There is no sweating, gentlemen. Why there is no sweating is because the hypothalamus has failed and it is no longer able to give signals to your sweating glands. The temperature will rise. The body temperature will rise above 104 degree Fahrenheit. Red, hot, dry skin, gentlemen. If you consider here, cool, pale, clammy skin. Now, the fast deterioration in the level of response. If you ask him very, very simple question, sir, can we go to the, what's your name, sir? What, my name? Okay, my means he is not able to answer very, very simple questions. Rapid, strong pulse, gentlemen, and may lose consciousness. You can see faint and dizziness here, headache, dizziness, discomfort, restlessness, confusion. There is no sweating here. Here, there is a excessive sweating. The body temperature is high, red, hot, dry skin. Here, cool, pale, clammy skin. There is, he feels like dizziness or, vomiting. Here, fast deterioration in the level of response. Rapid, weak pulse, rapid, strong pulse. Muscle cramps here, and here may lose unconsciousness. What I can do, gentlemen, here is bring him to the shaded portion, and the temperature has gone up. Try to cool down the temperature. Use a fan to lower the temperature, and you can also use the ice packs. Normally the maximum heat loss is from the back of your head, so you can apply there, from the armpits, from the groin area, from the back of your knees. These are the areas to be considered, and have the victim drink fluids in case he is conscious. Am I clear on this, gentlemen? Can I move forward?
Yeah.
Yeah. So there's a
Yeah.
small video in Hindi. Would you like to watch it, or is it okay?
No, no, please show.
Yeah. So gentlemen, you want to watch it, or
Yeah, sure, sure.
okay, you want to watch it? Okay, sir. So where is that?
दोस्तों, क्या आप जानते हैं कि हीट स्ट्रोक से पीड़ित 10% लोगों की मृत्यु हो जाती है। दोस्तों, जो लोग लू लगने यानी हीट स्ट्रोक को गंभीर बीमारी नहीं मानते, उनको इस बीमारी को गंभीरता से लेना चाहिए। और जैसा कि आजकल मौसम है, गर्मी बहुत ही ज्यादा है, आपको इससे बच के रहना चाहिए। तो इस वीडियो में मैं आपको बताऊंगा कि हीट स्ट्रोक क्या होता है, आपको इससे कैसे बचना है, इसके क्या लक्षण हैं, इससे जुड़े क्या रिस्क फैक्टर्स हैं, और हीट स्ट्रोक के लिए आप क्या फर्स्ट एड दे सकते हैं, ये किस तरह से होता है, और इससे जुड़ी कुछ सावधानियां। तो शुरू करने से पहले मैं आप सभी का स्वागत करना चाहूंगा आपके और हमारे अपने हिंदी यूट्यूब चैनल आरोग्य में। हमारे चैनल से जुड़ी लेटेस्ट हेल्थ एंड ब्यूटी वीडियोस और आयुर्वेदिक टिप्स के लिए सब्सक्राइब करें और साथ ही दबाएं बेल आइकन को। तो बिना किसी देरी के हम अपने आज के टॉपिक पे आ जाते हैं, जो कि है हीट स्ट्रोक यानी कि लू लगना। सबसे पहले हम जानते हैं कि हीट स्ट्रोक असल में होता क्या है। दरअसल हमारी बॉडी का जो नॉर्मल टेम्परेचर होता है वो है 90 से 94 डिग्री फ़ारेनहाइट, और हमारी बॉडी का अपना नेचुरल मैकेनिज्म है जो कि इस टेम्परेचर को बनाए रखता है। तो अगर किसी वजह से ये टेम्परेचर इस रेंज से बढ़ जाए तो उस केस को हम हीट स्ट्रोक बोलते हैं। हीट स्ट्रोक में बॉडी का टेम्परेचर 104 डिग्री फ़ारेनहाइट तक भी जा सकता है, जो कि 40 डिग्री सेल्सियस के बराबर होता है। हीट स्ट्रोक में चक्कर आने से लेकर कोमा जितने गंभीर लक्षण दिखाई दे सकते हैं। हीट स्ट्रोक की वजह से रोगी के मानसिक स्थिति में बदलाव आ सकता है, यानी उसका मेंटल स्टेट बिगड़ सकता है। हीट स्ट्रोक के कारण मरीज को उत्तेजना, जुबान लड़खड़ाना, चिड़चिड़ापन होना और दौरे भी पड़ सकते हैं। हीट स्ट्रोक यानी लू लगने पर बॉडी का टेम्परेचर बुखार की तरह बढ़ जाता है। इसके अन्य लक्षण है जी मिचलाना, उल्टी होना, सांसों का तेज होना और हृदय की धड़कन का बढ़ जाना। दरअसल शरीर के बढ़े हुए तापमान को कम करने के लिए हृदय को अधिक मेहनत करनी पड़ती है, जिससे उस पर दबाव और उसकी धड़कनें बढ़ जाती हैं। कुछ केसेस में इसकी वजह से किडनी या फिर हार्ट फेलियर भी हो सकता है, जिससे रोगी की मृत्यु हो जाती है। 5 वर्ष से कम के बच्चों और 65 साल से अधिक के बुजुर्गों में हीट स्ट्रोक की चपेट में आने की ज्यादा संभावना रहती है। ऐसे लोग अगर ज्यादातर समय अपने घर में रहें तो बेहतर होगा। हृदय रोगी या फिर फेफड़ों और किडनी से संबंधित बीमारी से पीड़ित लोग इसकी चपेट में आसानी से आ सकते हैं। जिन लोगों को हाई ब्लड प्रेशर या फिर शुगर है, वो लोग भी इसकी चपेट में आसानी से आ सकते हैं। तो अब मैं आपको बताता हूँ हीट स्ट्रोक के लिए क्या फर्स्ट एड है। सबसे पहले तो आपको पीड़ित को किसी ठंडे स्थान पर ले जाना है और फिर उसे तेज पंखे या फिर एयर कंडीशनिंग में लेटा दे। उसके बाद रोगी के गैर जरूरी कपड़े को उतार दे और फिर पीड़ित को बर्फ के पानी या फिर ठंडे पानी से नहलाएं और कोशिश करें कि ज्यादा से ज्यादा उसको स्पंजिंग करें और उसके शरीर को गीला रखें। आप इसके साथ रोगी की आर्मपिट यानी बगल में, गर्दन और कमर पे आइस पैक लगा सकते हैं। तो ये सिर्फ फर्स्ट एड था। आप इसके बाद तुरंत डॉक्टर की सलाह जरूर लें। इसके बाद मैं कुछ अब जनरल प्रिकॉशंस बताता हूँ जो हम सभी को अपनानी चाहिए। घर से बाहर अधिक समय ना बिताएं। सुबह 9 बजे से शाम को 5 बजे तक कोशिश करें कि घर से बाहर या फिर सीधा धूप में ना निकले। सिर को आपको डायरेक्ट सनलाइट से बचाना है। कोशिश करिए कि आप कुछ कैप या फिर अपने सर को किसी भी चीज से ढक लें। आप जब घर से बाहर निकले तो डार्क कलर के कपड़े ना पहने। आप हल्के कलर के कपड़े पहन सकते हैं क्योंकि डार्क कलर ज्यादा हीट एब्जॉर्ब करता है। आप थोड़ी थोड़ी देर में पानी पीते रहे। आप प्यास लगने का वेट ना करें। आपको प्यास नहीं है तो भी पानी पीते रहे। जितना आप पानी ज्यादा पिएंगे, आपकी बॉडी नेचुरली आपकी बॉडी के टेम्परेचर को मेंटेन करेगी। आपकी बॉडी इससे हाइड्रेटेड रहेगी और आपके पसीने निकलने से आपकी बॉडी का तापमान भी बना रहेगा। आप पेशाब करते हुए अपने पेशाब के रंग को जरूर देखें। अगर आपको लगे कि ये थोड़ा सा भी गाढ़े रंग का है तो इसका मतलब है कि आपकी बॉडी में पानी की कमी होने लगी है। ऐसी स्थिति में आप जितना हो सके तरल पदार्थों का सेवन करें। आप जूस, छाछ और पानी को अधिक से अधिक मात्रा में पिएं। अब गर्मियों के मौसम में आप दिन में 3 बार खाने की जगह छोटी छोटी मील्स 6 बार ले सकते हैं। अगर कोई रोगी हीट स्ट्रोक से ठीक हो जाए तो उसके बाद भी उसे 3 से 4 हफ्ते तक सावधानियां जरूर बरतनी चाहिए, क्योंकि ऐसे लोगों को दोबारा हीट स्ट्रोक यानी लू लगने की संभावना बनी रहती है। हीट स्ट्रोक की बीमारी हृदय के रोगियों के लिए बहुत ही घातक है। तो अगर किसी को भी हृदय से संबंधित कोई भी बीमारी है तो वो इन बताई गई सावधानियों को जरूर बरतें। मैं आशा करता हूँ आपको हमारे द्वारा बताई गई जानकारी अच्छी लगी होगी। अगर आपको वीडियो अच्छी लगी,
All right, gentlemen. So, yeah. Can I move forward, gentlemen? Was the video informative?
Yes, yes.
Yeah. Okay.
Yes.
So if the temperature goes up, problem. If the temperature goes down, more problem. So hypo means less, hyper means more. So hypothermia, that means thermia is something related to heat. Hypo is low heat. The body temperature has gone down. Hypothermia is a medical emergency that occurs when your body loses heat faster than it can produce heat, causing a dangerously low body temperature. Normal temperature is around 98.6 degree Fahrenheit. So, gentlemen, what are the symptoms? Irritational behavior, drowsiness or very low energy, confusion, memory loss, slow, shallow breathing, weak pulse, slurred speech or mumbling, shivering. Why shivering, gentlemen? Who is going to tell me? Who is going to tell me why shivering in the hypothermia condition? Who is going to tell me?
The body tries to bring the temperature up, and in that order, I think.
Perfect, sir. Perfect answer, sir. Who has answered this?
Paritosh.
Very good, sir. Very good. So, and the clumsiness or lack of coordination and the risk will increase German exhaustion if you're exhausted, older age, mental problems, certain medical conditions, if you're under medication. Now, gentlemen, what do we need to do? Be gentle. Move the person out of the cold. Remove the wet clothing. Cover the person with the blanket. This is what you can do. insulate the person's body from the cold ground. For example, if you're in the life raft, gentlemen, maybe you'll feel the cold from the bottom, from the floor, the raft floor. So what you can do is you can inflate the floor, gentlemen. Once you come here for the practical, we'll demonstrate you how to inflate the life raft floor, and then monitor the breathing, gentlemen.